Welcome to Amazing People number 9. This is my guest, Dr. Ravi Shridar. He is a radiation oncologist in Orlando, Florida, and we're going to talk about everything from being a doctor to his life to habits and probably some things that are going on within the world and society. So I hope you enjoy it as much as we're going to enjoy filming it. Welcome.
Thank you for having me. Yeah.
Thank you. So can we start with a little bit of a biography, a little bit of an introduction? Where do you come from? How did you end up in this position where you're a radiation oncologist and sitting here with me now?
Okay. So both of my parents are academics. They emigrated from India. Initially, they moved in Canada. They both took jobs at the University of Windsor. My dad is a professor of engineer. My mom was a biologist at that time, just got her master's. And I think as the job market started to flourish, and we were on a border city, Windsor versus Detroit, so making a move from one country that wasn't a big location change, but it was a big culture change. But my dad ended up taking a chair position at the University of Michigan Dearborn, teaching engineering. Mom ended up getting a technician job at Wayne State University. She eventually enrolled in the PhD program and ended up getting her PhD. But one of the things was that I knew I was probably going to do something academic. That's just kind of the culture that we were in.
Academic or STEM?
Academic STEM. So,
Okay.
whether it was engineer or biological sciences, it was probably going to be something in the academic world, university world. And so I did, and just, I spent a couple of weeks with my dad working in his lab and working with his colleagues. And the engineering thing just didn't click with me. Then I spent the next couple of weeks going to work with my mom during the summer, and I just loved it. And so I took a real interest in it. And so I was always, during high school, I would do summers working in the lab there. Initially was washing dishes, and there is a proper way to wash dishes in a scientific lab. And then as her bosses kind of saw that I was interested, they kind of mentored me and fostered me, and I was starting to do helping them to set up simple experiments and that sort of thing, and that just grew my love for doing kind of the bench side research.
Were you intentional in taking that lab job? Like, was this a thing that you hoped would help you get into a medical thing?
I think that's
more organic.
Yeah, I think growing in the era that I grew up in, basically kids of Indian parents either went into engineering or they went into medicine.
That's the same case in India too.
There was nobody going into law. There was nobody going into politics. Unlike you, and there was nobody going into acting. And now you see today, it's just they're tackling every industry.
Well, they have
head on in business, especially business and politics now, very vigorously. But there's still, even with all that said, there's still the number 1 and 2 driving careers for Indians is engineering and medicine. And I think that was the case with me. And so I was like, I didn't fall into the engineering camp. I fell into kind of like the medical camp. So I kind of knew I was going to be a doctor. And then it was just trying to figure out, well, what exactly do I want to do? My mom worked in basically a cancer biology lab. And so I think just from that initial upbringing, I think I knew, okay, I'm probably going to do something cancer, but I don't know what. I didn't know if I was going to be a surgeon. I didn't know if I was just going to be an oncologist. I had no clue. Ended up going to Wayne State University. Ended up getting a full,
Where's that?
In Detroit, Michigan.
Okay.
I ended up getting a full ride, and because I was taking classes there, I was able to work in the lab longer hours and actually starting to do real experiments. And actually during my undergrad, because of all the great mentoring I got, I was able to actually get my name on 6 publications, which at that time was pretty impressive for an undergraduate. That kind of drove me, and that made it, I ended up getting into medical school probably because of that. I'll be the first to say that I'm probably one of the lousiest test takers growing up, which is unusual for probably most Indian kids. But my MCAT scores
maybe for most doctors also.
yeah, possibly, but my MCAT scores were average at best. But I had this drive and passion for the scientific research, and I think at least being able to get that interview, I think they were able to see that, and they gave me a chance. And then so I ended up going to Wayne State, ended up doing a combined program, MD and PhD. So my 4 years
MD
of
and
med school,
PhD, okay.
yeah. So my 4 years of med school turned into 8 years of medical school. I ended up getting a PhD in a cancer biology lab, and again, I still didn't. I understood the research component of all of this stuff, but understanding integrating all of that into the clinical world was still, lost on me.